Training day number 6 in our recovery from heart surgery and Lyme disease. Today we're going to continue on with the neural stimulations, and we're going to add in a few more, so we'll get right to it. Again, we're stimulating the sensory component of the motor nerves for the abdominal musculature. Just move that towel over the muscles, ribs, down to the hip there, the pelvis, back up, across. The more you do this each day, it's going to get stronger and stronger, and you have more of a facilitated contraction of those muscles, of that core musculature. The next part, we're taking the vestibulocoelic reflex again. So head nice in position, then you're going to push your head into your hand. Keep holding. And relax. I think you'll find day to day, as you continue to work on these, the facilitation will increase. It'll get easier as you adapt to the exercises. Again. A little break. Again, this is to facilitate those core muscles, continue to activate them. Here we go. Okay, that core should be fired up some more. We're going to continue on with this, with doing some eye exercises. Now, eye exercises are very powerful influencers of the nervous system because they are so close to the brain. This is the drill. We're going to do a near-far drill. So you're going to hold your thumb out, look at that, and bring it in a little bit. It needs to be within 3 to 6 feet from your eyes. And look at that for a second, then look far away, something that's at least 10 feet or so or further. Look back, 1 second for each point. And you're going to do about 10 of those, 10 to 20. Start out at a lower rep range at first to see how your nervous system will respond to it. The other one we're going to add in this time is continuing with that fascial stimulation, which we'll do next. But this one, that fascial continuation goes all the way up to the jaw. So we're going to mobilize the jaw some. I want you to just bring it, open your mouth and bring it side to side. You don't want to stop at either end, just keep it nice and fluid, moving back and forth. The next one is we're going to push the chin forward and pull it back. Forward, back. This one you can pause at the end ranges. Nice and controlled. Now you can see if those help facilitate your core. Continuing with the fascial stimulation, just like last time. Let the hips tip back, the ribs down, and you're going to just dig into the fascial line. It's right where the obliques and the rectus abdominis come together. It's already feeling better today. We'll continue with the next set. a nice facilitation of that core muscles. There we go. And lift up out of it. Don't lay back, because then you're stretching out those muscles. We want to contract them, shorten them. One more round. There we go, and that's good. That's nice facilitated. Then we're going to go into the next is the hold, which is very similar position. We're going to go back like this. We'll lift your bottom off the floor. Keep the ribs down. Hands can be down or up. And go ahead, hold. Don't crank the neck. There we go. And come up out of it. Again, don't lay back in these, because that's going to counteract what you're trying to do. Feeling better every day. Here we go. Next one. Keep holding legs together. There we go. First week or two, when you're doing this, use it as an introductory. Work on volume. Don't worry about intensity. Work on volume at first. For the first 3 weeks after the 2-week introductory period, 1 to 2 week introductory period, then work on 3 weeks of volume, and then work on intensity after that. The final exercise for the isometrics body weight training is a hold position. So I'm going to be lifting up and tucking up my knees again. Here we go. It felt good. It felt good. Getting better every day. Make sure with this one you're lifting up right here as high as you can, so pushing those shoulders down. And again. With this one you want to try to remain stable as possible. No additional movements as you are able. Last one. That's it. We're back again on the bike. We're going to do cardiac output conditioning, and this time we're going to try to shoot for 20 minutes as we continue to progress. Getting warmed up right now. We're working in the 120 to 140 range for the cardiac output session. We're going to bring the heart rate up to 140, try to lock it in there for a minute or two, and then we're going to bring it down to 120 and lock that in for again a minute or two. On the cool down now, it was a good cardiac output session. We got a little bit more control. It's still difficult, the more sessions of the cardiac output, but it's getting better. It's getting better, little by little. Every day, another step forward.